Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 501. I am so excited for today's guest. We have Megan Williams on the show of The System. I've been looking high and low for years for a better way to do health insurance. Because I'm self-employed, my podcast is my income, and all the other things I do, like holistic health coaching. I'm self-employed, and so for years I've had to buy my own health insurance, which usually our family of three pays $1,400 a month for okay health insurance. It's not that great because we still have to pay $9,500 out of pocket before we really start getting coverage. So it's been just very expensive, and we can only see our chiropractor 10 times a year. We can only see our naturopath a few times a year. Like, we get one free visit a year, and then everything else is just pretty much out of pocket. It's been very stressful to have to pay for our own health insurance. And talking to a lot of my friends, even their health insurance is covered by their jobs is really not that great. And then a lot of my friends end up either buying a secondary health insurance to kind of try to pad on and compensate for what they have. Or some of my friends simply don't have health insurance at all. I have one who, she just had surgery to remove a benign tumor, and she doesn't have health insurance. It's really scary out there. Her husband's work provides health insurance, but the insurance they sell to the employees is so incredibly expensive, and it's the way worse coverage than what I have at $1,400 a month. Now, I'm from Canada originally, so this concept of paying for health insurance and having to go on the market every year and go on the exchange, right? I have a broker that I talk to, and having to shop for your health insurance to get locked into for a year. It's been super stressful. I look at spreadsheets and compare them all. But at the end of the day, I've never had a good experience with any health insurance company since I've been self-employed back in 2010. So I've been looking and looking and looking. I have a friend who was in a health share system, and she had some good experiences. She had some bad experiences. I've talked to a few other friends that have done more like alternative style, and some had really great stories. Some were okay. Nothing was as bad as the traditional health insurance that we have now. But I've been looking, I'm going, there's gotta be a company out there. There's gotta be a better way, because I want to have, access to preventive holistic medicine. This is what I invest in. I invest in my health. So I want my health insurance to also be something that reflects my values. And I know that a lot of my listeners want a type of health insurance that reflects their values of focusing on freedom of choice, focusing on being able to make holistic preventive medicine affordable. And that's how I found Megan Williams. So in walks Megan, teaches me all about this amazing company. And I'm really, really, really excited because it's something that now this is for people in the United States. I get it. My Canadian listeners, maybe you'll just find this interesting simply because it's like looking at a different planet when it comes to how it works in America. But most of my listeners are in the United States. And even if you do have adequate coverage through your work, you might have kids that have outgrown your system. Like, if they're 27 years old, they can't be in your coverage anymore. And there's so many people that don't have good health insurance simply because it's unaffordable. Megan, I'm really excited to have you today because you're going to teach us about your system, that helps us to have affordable coverage that's comprehensive, that aligns with our values, so that we can go see our chiropractor, we can see our licensed naturopathic doctor, that we can get the lab work once a year, to look at everything, make sure that we're on the right track, everything that I normally go to, all the cool stuff I normally go to. And then, of course, having the whoopsie daisies in life, like the ER visit because your kid broke his arm or something like that. That's all covered as well. So I'm very excited to talk to you today because I think that this is a tool that's going to help so many of my listeners. And it's so needed, and it's so frustrating and heartbreaking for people who don't have the coverage, especially the coverage that rewards them for making good, healthy choices like holistic and preventive healthcare. Now, listeners can go to learntruehealth.com/healthcare to check out this system and see if it's right for them. I was first amazed by the amount of money I would save. It is like a fraction of the cost. And I thought the numbers were wrong. I was like, this can't be right. There's got to be a glitch or something. It's way more affordable. And I've always kind of looked at health insurance like it's a racket. Like there's someone at the top, like making a ton of money, jumping into piles of bills and like swimming in it, like that cartoon duck that swims through his money. I just imagine there's these like evil billionaires sitting at the top of the food chain collecting all the money because health insurance is so crazy expensive. And so here we have the system that you provide and teach us about that allows us to pay a fraction of the price and yet have more coverage and better coverage than what I've been paying for years for. So I'm really excited to get into it. learntruehealth.com/healthcare. Definitely for listeners who this is a need. I know you'll love it. Megan, please share with us, how have you been doing with this, with all of your clients, helping them? I know you have a ton of stories. I'd love to hear a bit about how you got into all this.
Absolutely. Well, first, Ashley, thank you for having me today. I love sharing and giving value, and you have been doing this for years, which is so exciting that you've got so many people who have been blessed by your insights. And just listening to you, you are an expert already all about it. Even though I know you claim to be Canadian, you definitely have the terms down as us Americans do that, dang it, it stinks when you're an independent contractor and you have to pay for it yourself. And you hit so many points that I think are difficult points for so many of us. You hit, how much it costs every month, and then can we even afford the out-of-pocket deductibles and co-pays that come along with that? And even when employers are offering it to try to retain their clients, they're getting priced out of good plans. And so you're getting subpar, and many providers, doctors, hospitals don't even want to work with it. And then the fact that you even mentioned, there's brokers out there that are trying to be solution oriented, make a little bit of money, trying to help people like you and me on the marketplace. But the problem is if you're looking at price point, you're cutting out all the care. And so this has been something that really is difficult. And just like you, I've been an independent contractor for the last 17 plus years. Prior, I taught high school, and my husband was in law enforcement. So those are, quote, jobs that give you benefits, right? So you're thinking, oh, this is great, I get these benefits. But there are so many fine little gotchas in those contracts that we've learned over the years. And so when I saw this last year, we partnered. Let me just give you a little background. I have been offering solutions for high prices for a lot of different essential services for the last 20 years. My husband and I really love helping people. We love bringing them more value. We love, getting to have great relationships just like you. And what was so interesting is we were introduced to our healthcare option here with Impact, and we knew that we were not going to offer something that would not really be a solution. Like, this is a number one money, it's like a house payment. You have to pay for it, right? Or you have to knock on wood and pray nothing happens. Like you just said, so many people go without it. And Ryan and I were not going to even say one word about it unless we knew it was going to be a good solution. And so I would love to kind of hit some of the points that you talked about and why this is so great. But I do want everyone to understand that I get it. I get what people are paying for. I get what people are, not wanting to pay for. And I'll give a great personal example, and then we'll get into the benefits of this. So we had healthcare through our great providers, right, that are the ones paid for. And I had twins back in 2010. And I had to take one of my boys to get an x-ray because he was crying, and he never cried. And he was like the happiest baby ever. He was about 10 months old. We get there. I called the insurance company and said, okay, where should I go? What's, quote, in network? and we go over to this facility to get an x-ray. The doctor saw us for literally maybe 8 minutes after the x-ray, told us he just needed a sling, and his little collarbone was broken, but that's how you repair it. A few weeks later, I get a bill for $13,000.
What?
And I'm like, are you kidding me? So I call up this big major insurance company that's supposed to, be included. All this stuff's supposed to be included. And they're like, oh, well, if you had gone to the hospital at this entrance, then you would have been a network. But because you went to their outpatient on the other side of the building, that wasn't in our network. And I said to them, I am paying you $2,400 a month to have healthcare. And you're telling me that you're not going to help me work this out. They're like, no, it's out of network. So you're responsible for this. Now that's normal. Out of network for a family can be close to $22,000 a year. I was ticked. I canceled my insurance that day. I called the little outpatient, I thought, hospital and worked with them. And I ended up paying cash and renegotiating prices. And mind you, this is 13 years ago. And I thought, this is ridiculous. Well, I was like, I don't want healthcare. I'm not paying for this. I'll just pay cash. With cash is king. And at that point in 2010, you could just pay cash. You didn't have to do it. And then the government changed the rules. And you were fined if you didn't have healthcare. And then all of a sudden, at first, the fines were not that expensive. And then once you made too much money, the fines became out of control. And so they then instill this idea of affordable health care. But the problem is anybody in this country who makes a decent living cannot get the subsidies, or they can get subsidies until they show that they made more income. And then again, you have more fines. Yep. So it's this broken system. And so again, Ryan and I were looking. We have been praying for solutions, and we have tried everything. We've gone with, big disabilities. We've gone with low coverage, low payments, but then it has a lot of piecemeal coverage, and then pay cash for things. But ultimately, with 3 boys, there's no way we can live like that. And so when we were introduced to this, we were blown away. And I will tell you, first off, everybody, the neat thing about this option in this group share program is that it is a nonprofit. So there isn't someone at the top trying to make all the money on us. And that got me really excited when I learned that nobody owns it, because it's not a company. It's a nonprofit, non-insurance alternative that gives us a solution. And so just like you were saying, Ashley, that, for most of us who are generally healthy, we were paying into a broken system, a system that is for everybody, that 3% of the country, maybe 5% of the country that really needs healthcare. But the rest of us, we are healthy. We are looking for alternatives. We want to use chiropractors. We want to use holistic, ways. And even today, I had a good friend call me. She's been in our program, but she's been so afraid to use it because she thought there's gotchas. And then she used our telemedicine, which we have unlimited access to, everyone, with $0 provider fees. And she was blown away. She's like, in 2 minutes, I was talking to a doctor and I told her what was going on, and they got me 2 prescriptions in 1 hour. She's like, I was worried for nothing. I said, and she goes, and it was so simple. And I started laughing. I said, I know we are brainwashed to think it's going to be complicated. It's going to be difficult. And what our group has done is modernized this, made it affordable, but giving us, just like you said, the freedom and control back to us. So,
right.
I'm
so
thrilled.
Your monthly fee that you pay, which is a fraction of what, normal health insurance, like I'm paying $1,400 a month for health insurance. Is not that great. I'm frustrated that we have to pay out of pocket, $9,500 before we start really getting, coverage. And our family, knock on wood, doesn't have, I'm going to knock on my sauna, my sunlight and sauna. That's just right beside me. That's wood. I know that's wood.
Yes.
Thank God we're in good health, right? So
right.
we have the oopsies that happen once in a while, and that's why we have insurance. But like I said, I want to go to my chiropractor, I want to go to my acupuncturist, I want to go to my licensed naturopathic physician. my holistic providers, I want them paid for. And yeah, I'd love to have access to quick telemedicine, to speak to a doctor, just to be like, hey, should I go to the clinic with my son? He's got a weird rash. And, what do you think about this? And it's free. I'd love that it's,
Yeah.
so the
Okay.
gotchas are something that is looming in my mind, like, well, that sounds too good to be true because it costs so little and you're getting way better coverage. Can they just drop you? Like, I have a friend, a different company, totally separate company, but I have a friend who was in sort of a health share thing, and it was like, well, if you do this, then we'll drop you. Right.
That's right.
And so the fear is,
Yeah.
well, is this something because is it in a regulated industry? Can they just drop you if they decide to? So we definitely want to talk about those red flags, those elephants in the room. But one thing
Yes.
that I first want to talk about, though, is that this idea of in-network and out-of-network, what you described happened to us similarly. But this is back when my husband, he was a foreman union carpenter. This is about 13 years ago. Also, it was 2010. And so he had I mean, the carpenters union, what I thought, good health insurance. We go to the hospital. He had an oopsie. He had to have an emergency experience at the hospital. And it was a hospital that was in network. Then we get the bill. And the anesthesiologist, although working at the hospital at the time, was out of network. I'm like, how is this possible? So we had to pay the entire everything for the anesthesiologist because they wouldn't cover that bill.
Yep.
And yet I'm like, how is this possible? We went to a hospital that's in network, and my husband gets rushed off, to an ER, and any of the practitioners in that ER could not be covered by the insurance. And that's just like, I hate that. And when I gave birth to our son, we got a $5,000 bill within weeks of giving birth. I'm like, I did all the work.
Yes.
You guys didn't do anything. I did all the work. What is going on? So I hate that it's you have to pay every month, and then on top, and I don't use the word hate often, but I just loathe this system that makes us feel like we're indebted slaves. It is not freedom, and that you get surprise bills, and if you don't pay it, like they're going to send you to collections really quickly. And it's a surprise. We get to charge you whatever we want. That is
Right.
because it's out of network, and we decide what's in network and out of network, and you don't know beforehand. Even though you do all the research, we could switch out an anesthesiologist and put in one that was out of network, and you don't get to decide.
That's
so
right.
it's this idea of in network and out of network feels like a total scam. So the company that you're working with, that you're telling us about, there's no
Yes.
such thing as out of network.
Correct. And it's amazing. So the main points that I'm just going to hit, and then we're going to hit all these points you just said, is yes, there's no network providers, and now no provider network in general. So if something happens and you end up on a vacation at a hospital with your finger cut and they've got to do stitches, there's no triple the price because it, quote, was out of network. You can go to every doctor, every provider that you like and you're used to. And even if they've never heard of our group Impact, what's neat is we have what's called an EDI number. And that EDI number is what they have in the systems for every network. So we have our own licensing. Currently, we're in 47 states, though we can have service done in all states, all the countries around the world if something should happen. But the neat part is they will not triple the price because you're, quote, out of network. And that is really nice. The other great thing, because it's comprehensive medicine, anything you go to the doctor for, even before your deductibles are met, they do what's called reference-based pricing. And so, again, they are working to be our advocates. So that's what's so neat about it is that we've got an amazing price point, which we're going to explain how that works. We're going to answer that question that you just asked about. Could they kick you out for no reason? No, because we've got guidelines that are our legal standing that makes this work for everybody. And you go in totally transparent and you know exactly what you're going to get without any gotchas, no provider restrictions, which is huge. So again, no double, triple prices. And we've got this advocate with Impact that's going to work with us and help us every step of the way, which is so unique in this industry. It just doesn't happen anymore. It's just all about the bottom line. And for us, it's not. And so I think the neat thing is, one, we really are trying to help as many people as possible, and it's inclusive. So a lot of a background about sharing groups that we've heard is they're all religious based. Well, ours is under the umbrella of love thy neighbor, because that can be any religion. And yet we have no religious affiliation. Everybody is welcome and really there is no denial to be part of our group. The big thing is we do have a 36-month pre-existing, and we'll get into that in a little bit. But what I want to explain to everybody is we're looking for generally healthy people, right? All of us who don't go all the time, and we will love the idea of alternative. Well, because of that, the only thing they look at is the oldest member of the household's age and how many members are going to be part of the group. So it will be 1, 2, or 3 and more. So you could be a family of 8 and it's the same price if you're a family of 3. If you add more children, it doesn't hurt you, which again, that's kind of unheard of too.
Right.
And so like you said, the average American's paying $1,800 a month for decent healthcare coverage with a $10,000 family deductible, $22,000 out of network. That's what we're used to. Usually you get a 20-80 split when it comes to your co-shares and things like that. Well, let me explain how ours works.
The first thing can you just explain what 20-80 is? Because not everyone. So let's just slow it down.
Yeah.
Normally what people are paying. So like I said, I was paying our family of 3 is paying $1,400 a month, and we have to pay out of pocket $9,500 in a year before they start really covering things. And we have a few things like I can go to see a chiropractor 10 times a year, and after that it's out of pocket. Like I have to pay 100% of it basically. And so I've got a few things, but it's like. It's like buying car insurance. You're just hoping you don't get into an accident, but you're glad if you have it because it's going to sort of help for the big stuff. So and the 80-20 split, can you just explain that? That is a standard health insurance that we're not happy with. That's like just a train wreck, and it's a broken system. Okay, broken system explanation.
Yes. So the way it works in traditional healthcare is you have a deductible, and usually when you go to the doctor, you have to pay a copay or provider fee up front. But then they also, once you've met your deductible, so then you get the full bill. So you pay your provider fee, then they send the bill to the insurance. The insurance, reprices is if you have not met your deductible, then you pay that repriced bill to the doctor and they apply it. Well, the problem is as you are starting to utilize that, then you get to a place where now you've met your deductible and you have to pay 20% of the bill. They then will cover 80% of it. Mm-hmm. Well, normally that doesn't have a limit. So let's say a child, heaven forbid, gets cancer and you meet your in-network deductible of $10,000 for the year, and even some out-of-networks, because again, like we just heard with, Sweet Ashley, is that anesthesiologist was not in-network, so you have to pay that price. So you could have, they try to tell you, max out-of-pocket would be $12,000, or in her scenario, it was $9,500 if it was in-network. Out-of-network, that max might be $22,000. Well, then after that, heaven forbid, your child has to continue getting therapy, continue being in the hospital off and on. You then pay 20% of those bills. And if a bill comes to $1 million, you're now responsible for 20% of that. Mm-hmm. And what we've found is most of the bankruptcies in the United States comes because we cannot afford this healthcare. When something tragic comes, and like you said, these oopsies turn into something really big, now we're in a big bind. Well, the neat thing with our guidelines and the way that they have set us up for price point is it is the oldest member of the household. So in my family, I'm the oldest member of our household, and we have 5 members of our household. And so our price point is determined as I age, not by what medical expenses have happened in our family, which is huge. But we also know that no matter which threshold we pick, and I'm going to explain this in just a minute how this works, you get to pick 4 options. One is the amount of your deductible, which we call a primary responsibility amount. And then you pay your monthly rate, or what we know in traditional healthcare is called premiums. And you decide, do I want to pay less every month and have more exposure on the back end with our deductible? Or would I like to pay a little bit more for my monthly premium or my standard rate, and then have a household deductible that's much lower? And then once you meet that, we would then have a 10/90 split, but it maxes at $5,000 for the whole family for the year. So that same $1 million incident would not cost a family more than the amount they pick for their deductible, which their thresholds are $2,500, $5,000, $7,500, or $10,000, and $5,000 in your co-share amounts. So you could be as little as $7,500 for the year to $15,000 for your whole entire family. And you know going in that if something happens, this is all that I would come out of pocket besides my monthly rates. And that is a huge place to start from. Where most of the time we start at, like you said, $1,400 a month. It's piecemealed. We don't really know what they're going to cover, what they're not going to cover. And then all of a sudden we have bills coming out the wazoo because some are in network, some are out of network. And it is a colossal F up situation, right?
Right. And like you said, the $1 million, God forbid, knock on wood, I'm knocking my sunlight in, the $1 million medical bill, which would be over $200,000 for average healthcare. Your healthcare, it caps off after you pay your deductible. It caps off at that $5,000
yes,
per family.
yes, which is so incredible. It's incredible,
so amazing. So instead of like you said, the 20/80 split, it's a 10/90 split that gets capped at 5,000. That is insane, and it's so. I love it. It's so freeing for so many families. I just looked it up. 66.5% of all bankruptcies in the United States are caused by medical bills.
That's right. That's right.
It's really sick. It is a broken system that keeps us so stressed out and so stuck. And with the way the financial system is going, the way our food costs have risen, and we've got to get more creative when it comes to saving money and still being healthy.
Right.
This is a perfect system to do that. This system is the perfect system, because I've been looking at, like, I order, from example, like Azure Standard. I'll make sure the link is in the show notes. Azure Standard is a produce company that gets organic, fresh from the farm kind of thing. And you can also do bulk. I buy brown rice and beans in bulk, save a ton of money doing. I buy my sprouting seeds in bulk. I get frozen organic produce and fresh organic produce through them, and they get it direct from the farm, and they promise that it's not radiated, that there's no Bill Gates sprayed, that new kind of spray they called A-Peel, which has been around for a while, but sort of the last few years. But anyways, that's not sprayed on their produce. So they're a fantastic, and they're I just learned I've been buying from them for years, and one of my friends is like, and they're a Christian-based company. I'm like, well, I love it when a company is like, hey, these are our values, and we just want you to know that we're not going to poison you. You know, like, this is the stance we take, right? We're not going to poison you. But that's how I save money, because even though the pennies, pinching pennies, right? Money's tight. I'm not going to sacrifice my family's health. So I will still continue to buy organic, and I'm just going to find more and more creative ways to do so. Growing my own potatoes in my backyard, like that kind of thing, right? So I'm buying from companies that I can buy in bulk and save money, and looking at how can I cut costs but not cut care and not cut quality. And what I love about your company is that it's a fraction of the price, and we're getting even better care. Now, I know you got so much to talk on, but I'm going to tell you my absolute favorite part, but besides the fact that you're not going to get surprised $200,000 bills.
That's right.
So there's no surprises when it comes to the bills. But what I love is that you have you have so much more access to holistic health providers. So let's talk about what you do get to do with this insurance, with this, do you call it insurance?
We don't. We call it healthcare or health sharing,
Okay.
or a non-insurance alternative. And it's very nice because it runs. So the neat thing about our platform is it's a 5-year-old group. It's been around for 5 years. But what's so neat about it is they took this modern approach, and the CFO and the board have come together from past experience of what works and doesn't work. What are people wanting? What are they looking for? What do they need? And even to this day, there are some things holistically that we can't share into yet, but there is so much more available here than I've ever seen, which is incredible. I absolutely love it. So I'll give a great example of that. With our group, everybody in the entire group gets a wellness visit, and they get $150 of labs without having to pay into their PRA or deductible. That comes first. And then as you are getting treatments and you're working with new situations, they will actually share or apply visits up to 50 per member for either chiropractic, physical therapy, mental health, things that they might need, respiratory therapy, the things that sometimes are overlooked. And if we were doing them, it would prevent other things from happening, right? And I really like that because my chiropractor and I had worked out, a way to be affordable and be able to use him because my children are so athletic. We tend to have things pop out, hurt. Knees have popped out. We've ended up in ERs for a lot of stuff. And we have found that utilizing our chiropractor has prevented a lot of these issues. Well, when we came to Impact, we were really thrilled to know that each person got a combined visit. So let's just say we pay cash $200 for our chiropractic visits as a family, every month. I'm just going to use that number because it's a round number and it's easy, right? Maybe it was $100 a visit. Well, what we worked out with Impact is we paid our $100, and then our chiropractor staff then sent the paid invoice with the correct codes of treatment to Impact. Well, Impact then worked with them and said, okay, listen, this is a new treatment, so we need these codes. They worked out the correct codes, so everything was right. And then they could take that bill of $100 and apply it to our deductible. So things that I had been paying cash for years, 10, 15 years, now actually got applied to our PRA. So then one of my sons needed physical therapy, new therapy for an injury that he had. Again, we were able to take that physical therapy bill, get the codes, submit that to Impact, and have it be applied to our PRA. And before, we would just go and have that therapy done without getting any type of application to it. So it actually went to something, and that was a huge, oh my gosh, that was huge. And then over time, we had other preventative care that, as you're in your 40s, you need, and those were getting applied. But the amazing part was in some of the scenarios, they would readjust those prices. And some of them, it was just what we paid cash, but it got applied. And so very quickly, we had chosen as a family, we were paying, just so everybody knows our background, we had gotten it whittled down to about $1,800 a month for healthcare with a $10,000 family deductible. Now on Impact, we pay $605 a month with a $2,500 household PRA or deductible. So very quickly, $2,500 between 5 people and little incidences adds up quick. And it just made it so nice because as things were coming in and different processes and bills were coming in, Impact kept all that transparent. They worked with all the different providers. And over the last year, we have seen checks come back for things we paid for in cash with that 10% taken out. because they're like, no, 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 you've met this PRA now. We got to make sure you guys get your money back. So everything's doing the right. They're doing the right by us. And that was huge. Oh my gosh.
When I looked into it, like I said earlier, when I looked into how much our family of three would be paying, it came out to be about $600 with, like you said, the $2,500 household deductible, right? So like, and now, with the insurance I had, it was 9,500. So it was like, that's huge, a huge difference. And I was paying $1,400 a month, and now it's like closer to 600 with you guys. So it's like, that's how I was sitting there going, something's wrong. I didn't input something correct. There's got to be a glitch. How am I? Like, this is amazing paying for, and I love that you called it like a non-health insurance alternative, because that sounds like my latte. It's like, I'm going to have the non-dairy alternative, and it's better. It's healthier. This is like the healthier non-insurance alternative. This is a holistic non-insurance alternative. It just sounds like my entire diet. It's like, I'm going to have the non-meat or whatever.
Yes, no, it's so true. And it feels like that. So you're absolutely right. So those of us who are used to non-traditional, this is a perfect solution. Now, there are scenarios, Ashley, 100% that we're not the right fit, but it's not all or nothing. And that's some of the things that really blew my mind as I was helping families trying to find solutions. I'll give a great example. We had a mom who has been diabetic since she was born, and she needs very specific medicine, and it's very, very expensive. And so on the marketplace, there are some great plans that are out there, but again, it's nice, like you said, they're brokers who actually help. And so in our hunt for helping people find solutions and really trying to find the best so people can come to our group, we have made some really great strategic partnerships. So this family comes, we look at the price point, we look at everything it covers, and she goes, oh my goodness, this is perfect for my husband and kids. They don't have any issues. This is what we've been looking for. Well, they were a family of 4, and what we did was we were actually able to put the entire family on in our group with Impact. She worked with a broker that we knew and got a great diabetic coverage for what she needs, because that is pre-existing for her. But she can utilize our group as her secondary. So she gets her wellness visits, included. She gets her normal things. She gets all the benefits of the discounts for our prescriptions, but she gets what she needs with traditional. So yes, they're paying a little bit more, but the family, if they had kept the family on that traditional plan for the 4 of them, it was going to be $2,800 a month. Instead, she could have that plan for right around $600, and the family, including her, could be with us. They were a little older than us, so it was about $650 a month with the $2,500 deductible. Well, that was still $1,200 was still less than the $2,800 they would be paying if they were all on traditional. So it's not an all or nothing scenario. And I mean, we've had people who have high blood pressure. It's pre-existing. With us, any of those bills or doctor visits about high blood pressure would not be applied to the deductible or to sharing. But if they had a heart attack or they ended up in the hospital thinking they were having a heart attack, that would be shared with the group, because that pre-existing does not affect future cardiac and vascular events that could come up. So again, it's not an all or nothing for individuals with us. It just is, what do you feel comfortable with? We have sometimes where the parents don't even come to Impact. They stay with their employees' coverage, and their children come to us because it's so much more affordable to mix and match, per se.
Yeah.
So again, this is the non-traditional approach, folks, right? Like, it's not all or nothing. It's crazy, right? It's so nuts. I mean, they pay into, any type of chiropractic, physical therapy, vision therapy, occupational therapy, speech therapy, respirational. They look at mental health. They want to help us, with preventative ladies. We all get our preventative care and work with all of those things, and they'll share into it. It is big. they have limitations, but the limitations can be for our favor and or protect us from people abusing the situation. So it's really neat how they word our guidelines. And when you go to Ashley's link, you can look at the guidelines and see the transparency of it, which is huge. It's fantastic. So
Yes.
we love
So
that.
learnturehealth.com/healthcare. Definitely want to check that out. I love that I can go to my chiropractor every 2 weeks and not have to worry about it, that I can see my naturopath. I like to see her once every 6 months. I don't have major health issues, but I really like to check in twice a year. I like to just, I like to do some blood work if we need to, if we feel like we need to, but pretty much I like to do blood work once a year. But if there's anything coming up, I like to just check in on it. And I like knowing that I have access to these other services, like PT, physical therapy. I got to tell you, physical therapy for women after giving birth is the most life-changing thing. I have an interview about pelvic floor therapy, and it's not just for women. If men are having trouble urinating, have pain during sex, have pain during evacuation, they can also have a disruption in their pelvic floor. So I had this great interview about pelvic floor therapy. I've seen 3 different pelvic floor therapists after my second pregnancy. I saw 1 before my second pregnancy and 2 after. And one of them did a type of massage. Yes, it's vaginal massage. They wear a glove and everything. But she broke up scar tissue that I didn't even realize that this was the problem. And it corrected everything. It was amazing.
Wow.
I could walk properly, like my pelvis, and my chiropractor put me back together because my pelvis was twisted. But it's really interesting how scar tissue after giving birth vaginally can throw off the whole pelvic floor, which throws off the glutes, which throws off the hips, which throws off our gait. It all's connected. And I ended up, because my crappy, expensive health insurance wasn't covering it, I had to pay $5,500 out of pocket for all the PT I got. And it was so frustrating that I am paying so much money for health insurance, right? And then on top of that, I have to pay for the care I needed because I was in pain. And this might be TMI, but but I think well, my listeners know me. Intercourse for 7 years was painful, which doesn't make it fun for the husband because he's like, I don't want to hurt you. But that was the scar tissue left behind. And that was the stitches that the doctor did without really consulting me. And it caused so much scar tissue that it wasn't fun. It wasn't a fun experience the last 8 years. And then I had the PT and it was like, I was like everything down there was reset to like having kids. I couldn't believe it. And then finally there was no pain during intercourse. And it was like, I didn't realize how much I missed not having pain down there until it was reset. But this is pelvic floor PT, not covered by a lot of very expensive health insurance companies. And here we have these are licensed physical therapists. This is a legitimate service. This is a legitimate, physical therapy. And it can be covered by this non-insurance healthier alternative.
That's right. No, it's really true. So let's talk about maternity because that's one of the big questions. I have a new member family that they have 2 children. They want to have another one. And they've been looking, her husband changed jobs and the new job, healthcare wasn't really a viable option for them and their family. They're like, it's not really providing us care. It doesn't do what we want. And she just happened to see one of our posts on Facebook and she sent me a message. Her mom and I have been friends for years. And she's like, we really want to have another baby. And I said, okay, stop right there. If you come to us, we need to get you in the system fast because you need to be a member for 1 year before that baby is born. So she's like, okay. So she's been a member for 1 month and she's like, okay, I'm waiting 3 months. So 4 months total before we start trying for having another baby. And I started laughing. I said, yes, because with our program, you guys, you get up to $150,000 towards any single pregnancy event that is shared in the group. The neat part, just like you said, afterwards, physical therapy would be something that would definitely be shared with the group. You can pick which kind of doctor you can be performed with. So you can go to a facility, you can have a midwife come to your house, you can have a delivery, water delivery, as long as that midwife slash PA are all certified and registered in that state for delivery. And so that as long as they're properly licensed. Now, this is a huge option because so many people now are looking for alternatives for that. It is great. And then, of course, the newborn will become a member and added right when they're born. So it's perfect, and then they get all of their they get extra visits that first year. And then up to the age 6, they get all their visits and all that stuff included that is shared into the group to make it very affordable for us. And so I think that is a really huge blessing because, like you said, these doctors in and out of network, all of a sudden emergencies happen and you get these extra bills, and that's not what you want to be focused on when you have a baby. So that is a fantastic added benefit for our members, is that they really want us to recover and they want us to have great options. And absolutely that type of therapy would be included because it would fall under physical therapy. So it's fantastic.
Yeah, absolutely. I'm so excited. And then as far as people with pre-existing conditions, like asthma, for example, so they can still use your non-insurance healthier alternative. But when it comes to their pre-existing condition, it's not covered for the first 36 months.
So correct. So in our guidelines, pre-existing is quoted. Let me just say it exactly right so everyone understands. So pre-existing medical conditions are conditions which are known signs, symptoms, testing, diagnosis, treatment, or use of medicine occurring within the last 36 months. Now, asthma would be something that would be pre-existing because it's been diagnosed. But at the same time, the nice thing about asthma is that there aren't a ton of, besides having, you're having a prescription and being aware of it, there's not a long-term effect. So a lot of people would say, okay, I could come to this group. I know my prescriptions are going to be discounted because I'm now part of the group anyways. But maybe if I have a special respiratory scenario, if they've just been recently diagnosed prior to coming to the group, that would be considered pre-existing. But some people haven't had a treatment. They may just be on medicine for the last 10 years, but not had any type of diagnosis or treatment per se in the last 36 months. So anything new coming up would not be considered pre-existing. I'll give an example that happened to me personally. So I have acid reflux from having twins. They always say, oh, when you're pregnant, you have heartburn. Well, let me tell you, when you have twins, it has nothing to do with the hair on their head because mine too were bald. But it definitely was something that I got. And then I continued to have it off and on for the last 13 years. Well, when I was with my last traditional insurance, they saw on my doctor's notes that I had gotten a prescription for heartburn, and they told me that is pre-existing. And if anything ever comes up, an ulcer, esophagus cancer, anything, we will never cover those things because you have a pre-existing. Now, mind you, I'd gotten a medication once in the last 6 years, but it was in my records. So I come to Impact. And at that point, I was so mad that I didn't get prescriptions for it. So I haven't had a prescription for that for years. I just use over-the-counter stuff every once in a while because it's there. Well, on my application, when we become members, you fill out things that, have you had any issues? Well, I put in acid reflux because I'm honest, right? Well, then later I talked to Impact and I said, listen, I have acid reflux. I take medicine for it every once in a while. I said, is that a pre-existing? They said, no, it's not a pre-existing condition in a sense for your future care. So I thought, okay, well, I went in to be scoped for both my colonoscopy and my endoscopy, I think is how you say it, through your throat and to make sure there's no cancer, guys. When you're in your 40s, they care. They want to make sure, and it runs in our family. So I had to go get checked. And I'd been avoiding this for years, by the way. Well, the doctor goes in and realized I have a herniated esophagus. He did some different things during the procedure that is helped immensely. And I'm sure he put it on the bill. But what I did realize on my bill is I got all of that shared, quote, covered with the group, and it was not considered pre-existing. And so that was a huge thing for me to see that they said, okay, yeah, you might have gotten that prescription 4 years ago, but we're not going to hold it against you, even though I still take medicine for it. And I think that that was huge. That was a really big thing. So that it's not all or nothing. And when anyone joins our group or wants to even ask, they can talk to Impact prior to joining and ask all their personal questions and feel super comfortable about those answers just in case. So it's really nice for that.
Yeah, so they can go to learntohealth.com/healthcare, and that's where a lot of the information is. And then they can, they'll be able to find the phone number to talk to someone.
To request a quote,
To
absolutely.
request a quote, to talk about pre-existing. But let's say, okay, so I'm a little confused, and if I'm confused, then there's got to be listeners that are confused. Pre-existing.
Gotcha.
Again, I'm a Canadian here. This is
Yes, I know.
Not
I
making
know.
sense to me, right? Because like even an American can walk into a Canadian hospital and get care and
Right.
not be kicked out. But I'm not saying their system's any better. The healthcare system's broken because it's all about pharmaceuticals and profits and not. And in Canada, It's not about profits; it's about cutting costs. So it's again broken system. But we're doing the best we can to navigate a broken system by choosing freedom of choice, which is why I love this non-insurance healthy alternative to insurance, because we can have the freedom of choice to choose our practitioners. And there's no network. You can even go, and I want to talk about this. You can go to a different state. And if you're in a different country, you'll get coverage, and you're protected under this umbrella, that's what insurance is supposed to do. But I love that you have the freedom to choose your holistic licensed practitioners, and that makes me so excited. So let's just talk about this just so we can fully understand it. If someone has a pre-existing condition and then they join this wonderful non-insurance healthier alternative to insurance, after being with you guys for 36 months, is their pre-existing condition then covered, or are the pre-existing conditions never covered?
Okay, so let's use an example. So the condition has to not have had a treatment or a diagnosis or any signs, symptoms testing in 36 months. So I'll give an example of my friend who had shoulder surgery. So she just had a treatment. She had shoulder repair a year and a half ago. She joins Impact. She knows is if anything comes up with this left shoulder of hers, physical therapy, or she goes and gets more treatment on it, that would not be shared with the group. Now, Impact would help reprice any of those expenses. They would help be the liaison. But because that experience happened within 18 months, it's still in that 36 months. Now, let's say she doesn't have any issues. Her shoulder's been fine. And we finished 36 months, even though she's only been a member for that 18 months, right? Because now the total amount has been 36 months of that time of treatment, diagnose, surgery, whatever. Now, anything that comes up from that shoulder would be shared with the group, would be able to not be all out of pocket expenses. And so it's not about being a member for 36 months. It's when did that sign, symptom, diagnosis happen? So I have a friend who had a heart attack, and he has a big family, and they were paying $3,200 a month for their health care for their family of 8. And they were able to come to Impact for $700 a month. And his biggest concern was, I had this heart attack. Well, he gets a screening every year, but he has not been on medications. He has not had a diagnosis. He has not had a treatment for that heart attack for more than 36 months. So according to Impact's guidelines, it's as if it never existed.
Got
So
it.
so even though he gets a screening for it, that's not a treatment or a test. See the difference?
Yes.
So that's why this is so neat because like for example, if you've been diagnosed with cancer and it's in complete remission and you're only undergoing testing for surveillance purposes, as long as that cancer hasn't been treated for 36 months, it's as if it never happened.
Now, let's say they did have, let's say he did, like, for example, had his heart attack and then immediately joined. And so, so it's ongoing. Let's say it's an ongoing
Yes.
problem. It's a pre-existing condition, but it's ongoing because it's within the first 36 months. He's joined. Now,
So
what
that
happens
portion,
that,
yeah.
so is it forever for like 10 years, 20 years, 30 years that forever it's not covered, or is it just not covered for the first 36 months?
So it's not covered once. So let's say, I'll give another example of someone who had a heart attack New Year's Eve. He has joined Impact. Well, he is still getting treatment and medicine for that. So that portion, so he gets an employee stipend for his Medicare, for his medical, but his wife does not. So they decided to both come to Impact because the medicine that they prescribe him is $700 a month. Through Impact, though, because he's a member, it's only $73 a month.
Wow.
So he decided, so even though he has traditional healthcare that's going to cover his pre-existing heart attack scenario and all the testing and treatments he's still going through, he's almost done. The doctor's like, I can't believe how well you're doing. Let's just say that by October, he no longer needs to have treatment, medicine, like they'll just do a screening because everything's looking great. From October now, the clock will start for 36 months. So even though he's been a member since January, that one condition, the clock starts once the treatment stops. So it's not about membership, it's about when the treatment stops before you come.
Okay.
But he wanted to be a member, and it's his actual secondary as a member because he wanted the medication discounts that our group got him.
Yeah.
So it was worth, because he saved $600 a month on the medication, even though he's paying for a secondary with his wife with this. This is her full coverage. It's his secondary, but they're both on Impact because he wants those benefits. So again,
Yes.
it's not all or nothing. But the nice thing is, okay, yes, he has a heart attack, but if he had a stroke, that has nothing to do with the heart attack. Or if he got cancer in colon cancer, that has nothing to do with the heart attack. So all of those things would be shared with the group and have quote coverage.
Yeah. And so in a few years, let's say he's heart attack free, heart's fine,
Yep.
and he cleans up his diet, listens to my podcast, learns how to prevent and reverse heart disease. That's a really great episode with Dr. Esselstyn, Dr. Cadwell Esselstyn, how to reverse and prevent heart disease. It's just so you know,
Smart.
if you know anyone with heart disease, this is the book. I mean, the interview is amazing, obviously, but the book is phenomenal because he performed the world's longest study using food to reverse heart disease. And they've got, within 2 years, they take photos and they show you that there's 4 blockages in the heart. These were people who were too sick. They were on death's door, too sick to have stents put in or have surgery. They were like within weeks of dying, too sick to do anything else. So he's like, okay, well, let's just try diet. And he gets them on a whole food, plant-based, no salt, sugar, oil, flour, or alcohol diet. And they're eating and there's also there's stuff you have to eat that increases heart health, that increases the helps the endothelial lining of the cardiovascular system. It's like a science. This you're eating like 6 times a day of all these different foods that are all heart healthy. And he gets people to go from 4 blockages in the heart to 0 blockages in the heart. Angina pain gone in the first month. Blood clots in the legs gone very quickly. It's absolutely amazing. So anyway, let's say one of your guys has a heart attack, buys your non-insurance, healthier alternative to insurance, and gets this coverage. And then he cleans up his life. He doesn't have any heart health issues for 36 months, even though it was his pre-existing condition, but 36 months of no health problems around the heart. It is now no longer, according to you guys, it's no longer a pre-existing condition. And should he have heart issues in the future, like 5-10 years down the road, then it's covered?
Yes. That's exactly what I'm saying.
Okay.
You got it.
Yes.
You got it.
Yay, I understood it.
And I definitely
got it.
No, you did perfect. You did perfect. And I love that podcast because I have friends who need to listen to it too.
Yes, all your friends need to listen to my show. Absolutely.
That's right.
It's amazing. Our body has a God-given ability to heal itself.
Yes,
we
it does.
can heal ourselves. I reversed 5 major diagnoses, and so can you. Your body can heal
That's
itself.
right.
We just have to stop doing what everyone else is doing because everyone else
it's
is
true.
sick. We have to stop. Just go become a
Yes.
black sheep. Go against the grain. Cannot
right.
eat like everyone else. Can't stress out like everyone else. Right? We gotta.
That's
Anyways,
right.
listen to my show. Listen to my show.
No, it's so
love it.
true. It's so true. Well, and that goes to this whole thing of thinking outside the box. So then a lot of
Yes.
people ask me all the time, Ashley, they go, well, what about the providers? Will they even work with us? Because, most people haven't heard of Impact. Well, let me give you a little scenario. Most marketplace plans are, they're just the bare minimum. So what that means is the provider might get 70% of what Medicare pricing is, or 80% or 90%. Sometimes they're lucky with the Blue Cross Blue Shields, they'll get 100% on certain things. Well, the neat thing is when Impact looks at reference-based pricing, they're not trying to get the cheapest thing that nobody wants to work with us. They actually start their pricing with 150% of Medicare pricing. So now the doctors like working with us because the price point isn't insulting them.
Yeah.
Which is so good too. And, again, when you're thinking outside the box, half of these medical professionals, they've just been beat up. They've been told that they're not worth what they think they are. And we're saying, no, you're worth it. And we want to work together to find solutions. So when you're talking about how your body can heal, well, we can also heal these relationships with doctors and facilities and all of us, because we're coming to the table, not just trying to find the solutions for us, but also for the providers. And that's a really good place to be because it's about solutions. And that's what makes it so nice. You know what I mean?
Yes.
So I really love that. I love that, your listeners listen to outside the box thinking, but in this scenario, just like in yours, it's a win-win because we got to be smart. We got to make everybody feel important. So anyways, we're cutting the cost, but not the care, but the providers aren't getting gouged and said, oh, we don't care that you have 20 years of experience. We're not going to give you what you deserve. No, we're going to help you get what you deserve.
Right, because there's not some guy at the top, like it's not a pyramid where there's these like shareholders at the top going mwahaha, like sitting and swimming through bags of money, like all the other health, the traditional health insurance companies gouge the customers, they gouge the providers, they keep the profits for themselves. They're just evil.
Yes.
And then we have you guys, which are the non-insurance healthy alternative to insurance. Why should listeners go to learnchild.com/healthcare? You created a great website that explains this, that gives you can play with the quote and see how much your family would be paying, or individual. Maybe you're not a family, maybe you're just an individual, you're a single person, how much you'd be paying. Play with the quote meter. But what else will they see at learnchild.com/healthcare?
Well, what we love is we really wanted everyone to understand why this is so different. And so on the homepage, I do a 7-minute video that breaks down all the benefits of our program and helps you feel comfortable. But then we included videos that Impact has made over the years about important facts and why this is such a smart, different way of thinking. But on it, you could even see testimonials. You can see what groups could pay. We work with businesses where they've been priced out of healthcare options for their employees. And so they're losing employees to other companies. And we have an entire page that you can get a quote for your company. We also have wonderful videos that explain going to the doctor and how we work with everybody, and there are no network restrictions. It is very transparent. But when you're on the guideline little page, the overview is directly linked with our share group. So it's updated as they make legal changes. Everything is transparent. Everything is there. And what we love is that you don't have to try to figure it out. And I have a lawyer who's in our group, and he loves, when he read the guidelines, he's like, oh my goodness, this is one of the best written documents I've had, because if it's not in there, they're going to share it. They're very specific about what is a concern and what's not a concern. And like you said, we can play around with the pricing. Our individuals start at $73 a month. Families at $250 a month with a family of 2, and then of course 3 and more. We are not trying to make this difficult. We want everyone to feel very comfortable. So when you're on our site, you can even request more information and hear from Impact themselves and or our associates, because we've had so much experience as members of the program to help out as well. And we run live events that you can register and learn more about it. And of course, working directly with Ashley's group and in this community, we really know that we'll be able to give great solutions. And it's really nice for that too,
Right?
which we love. Yes.
I just love that you can get all the coverage you want, and it's cheaper than your car insurance. Like, just blows, or at least it's cheaper than I'm paying for car insurance. And I'm a good driver, and I
Yes,
I can
exactly.
knock on my sunlight and sauna. I haven't had any tickets in I don't know. I think I was in my 20s the last time. Oh, well, I mean, I've had a parking ticket a few years ago, but other than that, I haven't had any traffic violation. Knock on my sunlight and haven't had any traffic
That's
violations.
right.
But man, hell, car insurance is expensive, and
yeah.
you guys are cheaper than my car insurance. And I'm just thinking, like, I'm shaking my head thinking about how many Generation Z people, professionals, young professionals.
Yeah.
I'm friends with some of them who don't have health insurance because they're like, well, I can't afford that. I'm like, well, $73 a month? Yeah, you can. I have a
Yes.
friend who's a chef, and he's like, I can't afford this. He like half the year lives out of his truck because he loves to travel. And so he works at like resorts, like out in Vail, like in ski resorts. And then the rest of the year he's traveling and having fun. And he's just like, I can't afford health insurance. So I'm like, I can't wait to tell him $73 a month. He can absolutely afford it. And then when he cuts his thumb off or whatever, doing
Right.
something stupid while in
Yeah.
the kitchen, then or burns himself or something, right? Or I mean, he's traveling and gets, I don't know, like chased by a bear. I don't know what this
Yes.
guy's like up in Alaska half the time, but he's traveling all throughout the country, living the van life half the year. I'm thinking he would love this type of insurance, that he could go to any, a licensed provider in any state and be covered. How cool is that? That you can choose where you want to go. Doesn't matter your location. The insurance that I've had
Yeah.
for many years, that I've been buying for many years, the traditional insurance, I couldn't even go the other side of town. It wouldn't cover me. I had to only go in this one hospital network. It's just ridiculous. So if a problem happens, well, no, they say you're covered pretty much in every ER, but then if you're like transferred from the ER into care, you'd have to transfer to a different, I mean, it's just ridiculous. It's not the traditional system does not work. And I love that you can even do your non-insurance alternative to better insurance. You can do this as a secondary, which gives you even more coverage. So
That's
anyway,
right.
I like the savings. I like the savings, and I like that I now see more of my providers.
Yes.
So that's super exciting. Tell us a little bit about traveling. So you could choose to go see a doctor or a clinic in a different state, and also what about traveling? Like you're in Mexico, you're in Cancun. Tell us a bit about how that works.
Absolutely. So the neat thing is there is no provider restriction. So we had a young member who was diagnosed with cancer in the Arkansas area, and the doctors just weren't a good solution for this type of cancer. And so he ended up going to Dallas with his family and getting all of their coverage. Well, after the repricing, everything like that for the year, I mean, we're talking a couple $1 million of procedures. The out of pocket for the group was only over like around $280,000 for the year, because there's a markup is so absolutely insane. Well, the neat thing is if you're just traveling and you have an emergency, that also is covered. So you can have planned trips in America and go to any provider as long as it is not elective. So still today in healthcare, elective surgery is not covered. So sorry, ladies, facelifts, Botox, all the little fun extras that people might pick, hormone therapy of, elective, those things are not covered. Same with out of the country. So if you planned a specific surgery out of the country because it was cheaper, those are also not covered. But if I'm in Mexico, which I was a couple weeks ago, and had a situation with Coral that I needed to go run to an emergency room quickly, I got that bill and I could submit it to Impact. And yes, it was shareable with the group. And yes, it would be covered. So you could be traveling anywhere in the world. And if you end up in an emergency situation, those bills are going to come back through the group and get shared. And the nice part is there is no lifetime limit. So if you ended up, having a big scenario, you're not kicked out the next year because you cost the group too much money. Yeah. That's very important. The other really great thing is right now we do have an annual limit per member, not per household, of 500,000. But what they found in the last 5 years, even with these huge expenses, with the reference-based pricing, we aren't even getting close. I had a friend who was out golfing and had all of a sudden this abdominal pain that he thought he was dying. And they rushed to the emergency room to a hospital. He thought appendix, he thought, anything. Well, he ended up having a ruptured spleen. Oh. And he was in the hospital for 5 days. The entire bill came to over $152,000. It was actually 4 days, and then he was out. He said the fifth day. $152,000. Well, with the reference-based pricing, it came to $36,000. So he didn't even meet his max limit of the $5,000, 10%, co-share, because they were able to reprice it so much lower. And so this is a really great thing because, again, you've got advocates. And he said the best part was the little lady in billing at the hospital comes in and says, "Don't worry, Mr. Chris, we've got everything. We've talked to Impact. Everything's being paid for 100%. You don't have to worry about a thing. I'm working with them. You just get better." And then when he got home, he had a message from Impact saying, "Hey, we know you've had this surgery. We're hoping you're feeling better. If there's any questions or any bills come, let us know. We'll help take care of everything." What? Like, what is that? Because this is more personable. It really is about making it a better scenario. So
I love it. So can you, I was a little slow in catching the numbers. So it was $150,000 hospital bill. How much did he have to pay out of pocket?
Well, I actually even have this on one of our Zooms, and we're working on some of these kinds of examples so people can see. Well, it was repriced to $36,000. He paid $150 for there's a provider fee for the ER, so he paid $150. Then he still had $1,588 left on his deductible, or his primary responsibility amount. And then he paid the 10% of the co-share of that $36,000. So out of pocket for that entire expense, he paid $5,200, not $152,000.
So $152,000. That's like buying 3 brand new cars.
Yes.
Got down to $5,200 hospital bill, which, the whole, when the whole thing was said and done, $5,200. Yep. Now let's say that happens to one of our listeners who joins, who goes to learntoyourhealth.com/healthcare and checks out the cool Zooms and the videos and does the quote and then they join, they get their whole family in, and something, God forbid, happens to them and they need this kind of emergency medical help. And then they get on the other side of it and then they get the bill. Okay, so $52,000. Do they have to pay that all at once? Can they do a payment plan? How does that work?
Very good question. So the nice part about once Impact has negotiated and they send in their portion that they pay, then legally the hospital, that includes all the providers. So like this list had everybody on it, from the anesthesiologist to the pharmacy. when he was leaving the hospital. Okay, everybody. So this is once they accept that reference-based price, then that bill is locked. They can never come back and ask for more amounts. But Impact then would send you, okay, your portion is this, and then they send you where to send the bill. And absolutely, you can call their facility and say, okay, I'm making payments, and you might pay $1,000 for the next 5 months, and then you'll be done. So the nice part is that from my experience with them getting the lion's share of what they really needed, then you paying your percentage, they work with us as humans, right? To make those payments.
Yeah. Who are you paying that to? Are you paying that $5,200 to the hospital, or are you paying it to Impact? Okay. So you're paying it to the hospital. So you can negotiate with the hospital and pay, $200 a month instead of $1,000 a month. You can make it, they can make it manageable. Yeah. Okay. So
correct.
Yeah. But
because they got the big amount. So they're feeling the burden off their shoulders.
Yeah.
So then they are so much better at working with us.
Yeah.
The problem is when people say, oh, I have a $2 million bill and I want to pay you $200 a month. They're like, no, that's not how this works. Right. So absolutely. That's what's so nice about it. But the best part is that they legally can never come back and say, we want more money from you. So the nice part of having someone like Impact as your advocate, and then it's in the system legally, they can't come back and say, oh, well, we changed our mind. We don't want to just accept $36,000. We want you to pay $50,000.
Yeah.
They cannot do it because they accepted that price and took the money from Impact. So that's what's so nice about having a person like this and not just being cash paying where you could get screwed because you don't have an entity that is your kind of facilitator. And Impact has a legal team. They know all the rules. They know how the system works. And it's fantastic. Peace of mind.
Now, something you don't know about me is that 20 years ago, I was an insurance salesman. And funny enough, it took me this long to actually think about this and go, oh yeah, I used to sell insurance because it was 20 years ago, totally different lifetime ago. It was door to door. It was with Combined, and this is in Canada. And so I don't know if if you ever heard of Combined Health Insurance, but this is, again, 20 years ago, it was either they had accident insurance and they had sickness insurance. And what this for Canadians, we have our health insurance is like you pay almost half your paycheck goes to the social services, right? So like we get taxed like through the nose. It was just crazy. Right. It's like something like between 46 and 48% of your paycheck is bye-bye every month goes to just paying all the social services. And then, but healthcare is not so great in Canada, but again, pluses and minuses across the board. I don't think Canada is better than the United States or vice versa because it's a very different system, and the system's broken no matter where you go. So you got to think holistically and go to the right providers. But there I was in Canada, and I was selling door-to-door insurance. And what it was is you'd pay $14 a month, and then if you broke a bone, they would give you $1,000 or they'd give you $1,500. If you had like a car accident and so you'd miss some work, they would give you, for every day you're in the hospital or in ICU, they'd give you $5,000. Like they'd basically be giving you money to get injured, which is but obviously don't go buy the insurance and then injure yourself. And I'd met some people who had injured themselves and received the payouts, and they're like, yeah, this company's amazing, they really do pay out. And then they had a sickness insurance. So if someone was in the ICU because of an infection, or in the ER because of infection or whatever, if they had to miss work, basically, if they had to live in a hospital because of infection, they got paid every day a certain amount. And there was a limit, though. There was a cutoff. It's like, you can only have this many days in the hospital that we're going to pay. So we're going to pay like 30 days, let's say, for example, because it's not a traditional health insurance. It was just more like it was an accident and sickness insurance. Yeah, it was like, exactly. It's like, oh, you got hurt, let me insure. It was more like your paycheck insurance is what it was, which I thought was, an interesting safety net, right? Because life happens, not to everyone, but life happens, and it's great to have a safety net. So anyways, that was an interesting experience. Got to see that world while I was kind of figuring out life. And I did it for like a summer. It was interesting. It wasn't my cup of tea, but I'm meeting a ton of people and learning about an industry was interesting. And so the thought that came to mind, I know this is not that, but is there a limit to how many days someone could be in the hospital to like you said, you get to see 50 providers a year with all these different services. So all these services are covered. But what about, is there a cap where they're like, sorry, you've been in the hospital 14 days, now you're cut off? Is there any kind of like gotchas, like you said, when it comes to
there's not.
Yeah, go on.
I love it. I was going to say, I know exactly what you're saying. So this is a great thing to be paired with something, we call it in the United States disability insurance, or like you said, paycheck insurance, like Aflac, where they'll match, or you can get reimbursed for those copay provider fees and things like that. But what's neat is if somebody is in the hospital, like we had another friend who's been in Impact, and she was in the hospital for almost a month, and Impact shared everything with the group and repriced it all. So there isn't a limit in those kinds of things. There is an inpatient limit or things that are not eligible would be like inpatient rehab or residential drug alcohol treatments. So they give a specific list that is not eligible at all. And it's normal things that they don't share or cover in normal insurance, but there are no limits. If someone ended up in the hospital for a month because of whatever disease is going on, like this little boy who they relocated to the hospital in Dallas for months at a time, there is no limit on that. Like I said, with the repricing, then they have not met that limit for the annual amounts either. And so I think that what we can really know is that they're going to do their very best to make sure that we're taken care of. Now, there are some limits for home care as well. So some of the things they do share into is 40 visits for a member who has home care. So let's say they have an RN who has to come to the house and they're in their homes. That is limited to 40 visits for the year per member. And if someone needs transportation, there are like air ambulance and things like that. They are limited to $25,000 lifetime limits for those kinds of things. Usually, ambulances are about $500 to $600 of, usage. So that gives you a lot to work with. But there are some specific limits, and anything that is a limit, they specifically tell us in the guidelines. And if it doesn't say in the guidelines, then there's not a limit, which is really cool. So
I like it.
Yes, it's very transparent that way. And that's a great question, Ashley. Great question.
And all these details can be found at learntruehealth.com/healthcare. I love that you lay it out. You've made the website so easy to understand, and you've got the videos, and people, like you said, can read through everything, see what the limits are, see what the limits aren't. And if it isn't listed, it's not a limit. Even though it doesn't provide like rehab facilities, for example, it does provide mental health. So someone could go to like a licensed mental health professional and work on healing through addiction.
That's right.
Yeah. So it's not
absolutely
not that we're saying those people are screwed. It's just you're not going to pay for the Betty Ford clinic experience.
Correct.
Yeah.
Correct.
Okay.
Yeah. And as long as people are honest about we're looking for people who are making wise choices. So for example, my husband always says, if someone wanted to go skydiving, good for them. Like there's no limit in here, but some insurance companies won't cover any skydiving accidents. But my husband says the way they word it in the Impact is, let's say I wanted to go skydiving and I decided to throw my chute out first, then dive to my chute and put it on. Well, that was negligent behavior. And therefore, when you are hurt, injured, or killed, they're not going to share into that because that was stupid, right? Like if you're using illegal drugs, that's stupid. But if someone happened to get in a car accident and, they had been drinking, yes, those are going to first go to your car insurance, but Impact is going to share in those medical expenses as well, because those kinds of accidents do happen. They weren't trying to be grossly negligent, if that makes sense. So they do have a little provision that, protects people like us who don't want people to do stupid things and think that then we'll
Yeah.
share it. But I mean, hey, you got to live a life and have fun and go river rafting and do fun things, or, have a life. It's really nice because even motorcycle accidents are covered up to $125,000 per incident, which is a big deal. It's a really big deal. We had a young man who's 17 who his friend ran into him, severed his toe, almost lost his life, and impact is shared into the whole entire situation, even though he was on a dirt bike. And it was not he wasn't being negligent. It was an accident. And I think that that's also very important to understand, that there is a difference between negligence and accidents, and they work with us and help us, which is fantastic.
Love it. Love it. Love it. And another thing, I saw one of my friends, this is a few years ago. Again, I've been looking for this solution for years, and I had not been satisfied by all the other companies I'd seen until I found this company. I was like, finally, this is exactly what I've been looking for. I'm so excited. So my friend who's in a health share, it's a Christian health share company. And at first glance, it looked good. And then I looked further and it was like, well, you have to be this BMI. So body mass index, meaning you have to be skinny in order to be a member. And we're going to weigh you. And if so I get it. They just want healthy people. And if your cholesterol was this level, you can't be covered by us. And if you join us and you're skinny, but then you gain weight, you're going to get kicked out. And so that kind of health share company, I felt was, it was too restrictive. It wasn't giving freedom of choice. What I love about yours is there's, let's say someone is obese and they're working on themselves and they're working to, be healthier people. And 1/3 of the American population is overweight or obese. So that's really
right.
limits you if you were to not allow those people to join. And so there's a small increased fee. And I saw
Yes.
that and I thought, that's it. That's amazing. It's
Yep.
worth it for someone who's overweight, who they know they're overweight, they're doing their best. They're looking at being as healthy as possible, because weight loss, it should be a byproduct of a healthy lifestyle, and it's not the goal. It's the byproduct, right, of the goal being to be as healthy as possible, right?
That's right.
So eat healthy, exercise, lower your stress, get good nutrition. The weight's going to come off, and you're living healthier and healthier and healthier. And even skinny people can die of a heart attack, right? Like while
That's
they're running.
right.
So,
That's
but
right.
the point is that you guys don't exclude people who are overweight, or let's say everyone in the household except for the dad is overweight. You're not excluding the whole family because one member's overweight. The people who have some weight that they want to lose, have some weight to lose, they get to pay a little bit more, not an exorbitant amount, a little bit more. And then they get to be covered. And I thought,
That's right.
like, how inclusive is that? I love that you include people of all faiths. You include people who of all bodies, right? All bodies and all faiths.
That's
So
right.
I love that, and that you don't charge people more because they have a large family. So family of 8 or family of 3, they're not going to be, they've got enough expenses if they've got 5 kids, you know what I mean? Or they've got 6 kids, 7 kids, they've got enough expenses. And you're not going to continue to gouge people who have so many kids. And typically kids don't have a lot of health issues compared to adults. Hopefully, fingers crossed, that they listen to my show and follow all the wonderful health tips. So I really love that. I love that you can travel to different providers in different states. You can go to different countries and feel rest assured. I used to buy travel insurance. Being Canadian, I used to pay for and buy for a few $100s. I'd be traveling. I'm going down. I was doing every 3 months I'd go down to the States because I was doing different conferences and stuff like that. This is back in my 20s, and I would pay upwards of $500 for coverage and I never had to use it. I never used it, but I didn't want to be in the States without health insurance because I just knew that was a bad idea. So I bought traveler's insurance every time I went somewhere outside of Canada before I moved to the States. And just to know that it's covered is so reassuring. That is so cool.
Yeah, it really is peace of mind. And that's what we're trying to do with our group. And Ashley, I think all of your listeners are the kind of people who want that. They want to have the
Hmm.
choices, freedom. And that's what we're really trying to give. And what we love is grassroots movements like this, being able to share with people and let them make an educated decision for themselves. What
Hmm.
is the right fit? I love it. And you and your individuals and your tribe, I want to say, are educated. They want to have better options and solutions, and you are giving them that every single day. And I love that. I think that's fantastic.
Now, I think I know the answer, but I want to check. So, vision, dental, supplements, these are things that are not included?
That's correct. So a lot of times everyone thinks, oh, insurance, we have to have dental and vision. Well, you can get a policy for that very easily, anytime, anywhere, from any group. So what Impact has chosen to do currently is that if it has a medical connotation, like you were injured and you need surgery on your eyes or your mouth or your jaw. I had a young man whose roommate hit him in college. He
Mm.
had to have jaw surgery. The dentist came in and did that reconstructive surgery. Those are, of course, all shared. But when we're dealing with just having our teeth cleaned and our eyes looked at, that is not part of this group. But it is definitely something that people can find in America with tons of different brokers, and that's not a concern. I use Costco for one of mine, and then I've got a great family dentist that works out stuff as a small business owner for other business owners. So again, those are things that are, it's not on our guidelines because they're not as expensive to manage for a family. So
Right, right.
yeah.
But if it was like an abscessed tooth or like an eye
Yes.
infection, would that be covered?
Yes, because the eye infection would come from something that was medical usually. And
Yes.
so then it starts at a medical. Now the neat thing is you don't have to go to a doctor to get a referral to another doctor to get a referral to another doctor to have this be quote covered. If you were having infections, you could go right to that kind of doctor, or like my sister who she has been a member and her knee started bothering her. She went to a specific orthopedic that she had heard was the best. And she didn't have to go to 17 doctors beforehand and spend all the extra money. She just went right to him and started
Oh, I
doing
love that.
work
I
thing
love
with
that
him.
because my friend who's a different company, she's with like a healthcare company. Um, she has stenosis in the neck. She was in a car accident years ago, and stenosis is like the bones are closing in around the nerves. So she had
Yep.
pain going down her arm. And every few years she gets a CT scan, and she consults with different she has not gotten a surgery for it, but she's like debating, and she does everything natural to keep it at bay, and she's doing a really good job managing the pain. But she's like, she found the surgeon. She's like, I'm really interested in just cleaning up the bone spurs that are pushing on the nerves. And they're like, her insurance is like, no, you have to do it in this order. You have to see this doctor before you see this doctor. You have to get this scan before you see this. And it was like so confusing, so annoying. She couldn't just go see the guy. She had to
Right.
do all these other things first, and they wouldn't even cover her to see him until she had met their criteria. So I love the freedom. Like we said at the beginning, this gives freedom of choice and allows us to navigate the whole medical system, which is weird, allows us to choose the providers that are holistic, that are preventive, that help us to gain our health, to build our health up. You should only ever see a doctor who believes that you can build yourself up, that you can become healthier. And
That's
if
right.
they think that you're sick and you just need to be on drugs and you can't get healthy, then you need to get a second opinion, a third opinion, and see holistic doctors because they believe your body can heal itself. So the fact that we
That's
have
right.
the freedom to do it and the freedom to even cross state lines, I love it. I love it. Now you also, another thing you do is you also help companies to
Hmm.
create plans. So like the whole company. So if you had someone, like for example, a listener who has 10 employees or 50 employees or 500 employees, they can talk to you. And also if we have a listener who is an insurance broker, they
Yeah.
can talk to you. We can hook you guys up with Megan, and she can talk to you because insurance brokers love to provide this.
Yes,
And also small businesses love to provide this because it's cheaper for everyone and gives better care, gives better
that's right.
coverage. So everyone wins. And so Megan could talk to you. And then in addition, you've been doing this for 20 years. This company's been around for 5, but what you've been doing even before this is you help business owners, you help families, you help professionals to cut costs of other services.
Hmm.
I'm excited about that too, because we're living in a day and age right now where I am unwilling to eat eat food like conventionally grown food, right? They call it conventional. It's the weirdest thing. It's like organic it should conventionally grown should be organic.
That's
And then
right.
they should call conventional food like pesticide laden, right? But it's all marketing. It's all Orwellian marketing. So I'm paying more. Obviously, we're all paying more for food. I'm paying more for organic, clean food, and prices of everything have gone up, and they're going to continue to rise. Unfortunately, this is just the state of affairs. So for us to be able to afford being healthy, we have to figure out how to save money. And Megan showed me how to save hundreds of dollars on other things that I pay for already, which I'm really, really excited about. So Megan does that. That's what she does. She
Hmm.
does it for businesses. She does it for families. And this one thing, though, is what I was looking for, which is the ability, the learntourhealth.com/healthcare, the ability to get the coverage that you want at a fraction of the price and take those several $100s that you would be saving. Like for me, it goes from, I think it's about $650 for my family. That I used to pay 14, it was like
Yeah.
1432 or something, right? So I take that savings, hundreds of dollars, and I put that aside in my savings account, and I
Hmm.
get to then put that money towards the things that are healthy for us, like supplements, and just save it, keep it for a rainy day, keep it for because it's in my budget, keep it for when our family needs the help it needs, and just the peace of mind that we get that we're not shelling out $1,400 plus a month to a broken medical health insurance system. So
Yeah,
I'm
you're
so,
awesome.
yeah,
That's
I love
exactly
it. I
right.
love it so much. Yes, exactly. Megan, it's been so wonderful having you on the show.
Thank you.
I love the stories that you share. My I feel like this was God, God driven, right? To
Yes.
bring me to you at the right time. And I think this message is landing for people at the right time. Now, here's another question. Usually to buy insurance, because this isn't insurance, this is an alternative to insurance, is better than insurance in many ways. The the insurance industry has an open calendar period where you can only purchase at like in January. You can only purchase from December 15th to January 15th. That's the open calendar. And if you get dropped coverage, you don't have coverage till January or till
Right.
the end of December. So you're SOL if you're not able to stay covered. And some people lose coverage halfway through the year because they're changing jobs or got too expensive, they lost their job. This covers you right away, right?
That's right. Yeah, there is no open enrollment. There is no time frame. You can sign up the last day of a month and have coverage the very next month, as long as you do it by. I like to tell people to do it by 10 o'clock that night. But the nice thing is, yes, absolutely, we don't have to be worried. Now there are people, even with small businesses, that they may have signed contracts and they have to wait till open enrollment to turn that off and bring their whole company to us. But we can start with new employees that are coming in and we can get them coverage right away. We can also do it with families. So I started when the minute we got it, I started June 1st. I didn't have to wait until October or November to get on it again. And it's just amazing that they look at every scenario that could happen for families, individuals, businesses, and they are finding that solution. So absolutely no restrictions. Let's get you signed up right away, everybody, and get you the best plans. And you can cancel your other healthcare that next month. So you can pick a 4-month window when you go in to sign up for when you want it to start, and it gives you time to turn off your other insurance that you have before.
Oh, that's so cool. So when you say
Yeah.
the next month, so let's say it's the end of June and I sign up, then the beginning of July I'm covered, or do I have to wait till
Yep.
August?
Nope,
Oh, so it's
July
like the next
1st.
day. It's
The next day.
the next,
The next
yeah.
day.
If the last day of June, if I sign up the last day of June, let's say at 6 p.m., so it's not like waiting till 10
Yes.
p.m. So I sign up, I go to learntruehealth.com/healthcare and I sign up. And then the next day, which is the first of July, right? I'm covered.
That's right.
So cool.
Absolutely.
Love it.
Yep. It's that good. It's that quick and it's amazing. And the process to sign up takes less than 10 minutes for an individual. When you have a family of more, then they have a few questions for everybody's health. And you do need to know your kids' heights and weights, everybody. But that is about what takes the longest. And what we love is that it can work for anyone who's a resident in the United States here legally is welcome to be a member as well. So there's no restrictions on that either. So you can get signed up right away. Your kids can, and it will take you about 15 minutes to be in the system, and you're good to go for the next month.
That's a question I didn't think about. So you don't have to be, you can be abroad just living in the States. You don't have to be an American citizen.
Yes, as long as you're here as, with the correct documentation.
Right, like a green card.
Yeah,
or
a green card.
Visa. You have a visa.
Yep, you
student
have a
visa.
visa.
Could be students from abroad.
Yep.
Oh my gosh.
Yep,
Right?
employees, all sorts of things. And even in scenarios where the oldest member of the household is a citizen and maybe their spouse is not, but they're younger, that household can get coverage, including the non-resident. Kind of crazy. Yeah, it's very, very good.
Yeah.
So Impact will help any of those scenarios get the right documentation uploaded so they can have coverage for sure.
Awesome. Listeners, go to learntruehealth.com/healthcare, learntruehealth.com/healthcare. Check it out. Share it with all your friends who need this kind of coverage. I'm very excited that this is something that we can use to go to the kinds of practitioners we want, that we're not restricted by networks or by state lines, that we can go and see that amazing naturopath on the other state, or we can, get the care we need in a different state, in a different county or whatever. And that we can get telemedicine. There's so many things that we can get. And it's just amazing that it's way better and also way cheaper. That's like, that's what I want from everything. I want everything to be way better and way cheaper. So thank you, Megan, for coming on the show. This has been so exciting. I just know this is going to help. I can feel it. I can see my listeners. I know that this is going to be the answer to so many people's problems, because like we've discovered, 66.5% of bankruptcies is from medical expenses. How many people are suffering, either spending too much or they don't have any coverage at all? And not having coverage is dangerous, because then we ignore the little things, and we should do blood work every year. We should look at the labs, but with a holistic practitioner that can examine them and go, okay, you're not optimal. Let's get you optimal. Let's make these like slight changes to diet, lifestyle, exercise. Let's make these changes and help you get optimal. So my thing is, holistic health is about addressing every part of our life, including preventive medicine, and helping us become optimal in every aspect of our health. And we can't do that if we keep our head in the sand, right?
That's right.
I don't have health insurance, so I'm not going to go look. Like we can't keep our head in the sand. We have to look. And they say women live longer than men. I think it's because we're willing to look, and men are like, la, 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 la. No, no, no. If I don't look at it, it doesn't exist. La, 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 la. I'm just going to ignore it. Like, you can't do that. We can't ignore what's going on. We have to listen to the symptoms of the body, because that is the way our body communicates things to us. And then we also get labs just to check in, see what's going on. But when you go to a holistic practitioner that's licensed, they can help guide us and keep us healthy and make the right choices so that we can have optimal health, get so healthy we don't need medications. That's my goal for everyone. And we can accomplish that. And now we can accomplish it with cheaper coverage. So love it. Love it. Thank you so much, Megan. I'm so excited. Definitely check out all the videos that Megan made, learntruehealth.com/healthcare. And then for those who want to contact you directly, should they be like business owners that want to get like the big, they want to get all their employees, they want to offer it to their employees, or they have
There will
Oh,
be a place on your site in the link that they can request information, and we'll work directly with them to help
great.
them. But definitely through your link, everyone, utilize the link to get connected so we can know what kind of mindset you're coming from, and we'll have the best solutions for you.
Because you're going to take care of my people,
That's
my
right.
listeners. You're going to take care of them.
I
Awesome.
am.
Thank you, Megan. Thank you for taking care of my listeners. I want to make sure that we all we help those in need, and that's why we're here. So I appreciate you and what you do. And I know that I really want to have your husband on at some point because
Yes.
he's got some amazing stories. So we'll be hearing from him at some point because I'm just telling you I'm going to interview him. So now you know.
Perfect. No, I love that. And he'll give us a whole different insight to this that if for those of you who aren't convinced yet, you'll want to be part of this group when it's all said and done. It'll be great. So thank you again for having me, Ashley.
I appreciate you, Megan. Thanks so much.
Awesome.